Hello everyone. So welcome back to the new episode of our YouTube channel. Today I am going to show you a case of heart failure who presented to us with history of chest pain, rested at home for 2 days. I mean, he wasted some time at home and then came to us with all features of heart failure that we know: basal clefts, bilateral pedal edema, raised JVP, breathlessness, raised anti-pro-BNP. But when we sent his troponin I, it was in the range of 10,000s. So it was very clear, and the ECG showed some changes. So it was very clear that the patient had a non-ST elevation MI and with delayed treatment since he was at home for 2 days. Surprisingly, when I did the echo of this patient, the patient showed a big aneurysm, LV aneurysm in the right coronary artery territory. Now, LV aneurysms occur in approximately 5 to 7% of patients with myocardial infarction. But remember, they are very dangerous because they can lead to complications starting from heart failure that our patient had, to arrhythmias, to syncope, sudden cardiac death due to rupture, etc., etc. So it is very essential that we diagnose such patients right when the patients come to us and give the appropriate treatment so that complications can be minimized. That is the importance of doing a bedside or a immediate echocardiography when the patient comes to you to the casualty. The patient is currently okay, but definitely he would require cardiac surgery for the repair of that LV aneurysm that I am going to show. But the treatment always depends upon the patient's clinical scenario. LV aneurysms can be of two types. It can be a true aneurysm that the patient has, or it can be a pseudo aneurysm. What is the rough difference when we see on echocardiography? True aneurysms are having a wide neck commonly with flow in and out, means there is a diastolic flow, there is a systolic flow inside the aneurysm, whereas pseudo aneurysms are actually ruptured LV wall which are being sealed by any thrombus or the overlying pericardium with a very thin neck. Usually if we put a pulse Doppler in the pseudoaneurysm, it would show only systolic movement or systolic flow of blood, but no diastolic flow. All these things we will see live in the echo, but this is just to give an idea. LV aneurysms are very dangerous, so let us just jump to the echocardiographic features of this patient and see how to diagnose and treat such complications of myocardial infarction. So if the cameraman can bring the camera on the back side of the in front of the screen. So we'll just start with the echo of this patient. As you can see, this is the plaques view. This is called as the plaques view. This is the left ventricle. You can see the left ventricle is not that nicely moving and it is dilated also. This is the right ventricle. This is the aorta. This is the LA. But if you pay attention closely, I will try to adjust the view. If you try to pay a close attention, see there is a huge pouch that is formed from the LV wall. This is the LV. The LV should have been like this, but suddenly the LV is dipping with, if you pay attention to the wall compared to this thickness, this area of the LV is very much thinned out. So this is a danger zone where the LV can rupture, and this is nothing but a LV aneurysm that is formed after myocardial infarction. Since the patient didn't come to the hospital immediately, the treatment was delayed. This part of the LV has died, I should say in a local language, with thinning of the LV wall, which is a danger. This is the mitral valve. So this is a submitral large true aneurysm. There is no clot inside it. There is no rupture. This is the pericardium, but we can clearly see the thinned out LV wall. If I put color in this, you can see that the blood is actually flowing through this. If I try to put a pulse Doppler and try to see what is the flow inside the aneurysm, you can see there is a systolic flow, this is diastolic flow, there is a systolic flow, diastolic flow, systolic flow. So this is a true aneurysm which is showing flow inside and out during the cardiac cycle. If you pay attention, there is a haziness inside the LV cavity. You can see a haziness like floating clouds. These are nothing but layered clot. Very soon, had the patient not received treatment, this hazy blood would have been clotted and may have been settled here or in the LV. In the LA also you can see some hazy clot which will soon form into a clot if we do not treat the patient properly. If I show you the short axis view of the patient, very clearly you can see that this is again the LV. We have cut the heart in a transverse manner. So this is the LV, this is the mitral valve, but see, this is the inferior wall. The inferior wall again is showing this huge LV aneurysm with a slightly thinned out and dyed LV wall. This is not clot, this is moving with the LV wall. So this is something else, or a shadows like this. It is modifiable, but this is a thinned out LV which is dead, which has led to formation of this huge LV aneurysm. You can see this is the LV. The LV should have been like this, but this wall has stretched and bulged out because it is scarred, because it has no blood supply, because the artery supplying this part is blocked. This is the mitral valve. If I go up, this is the aortic valve, this is the RV, this is the pulmonary artery and all. If I come to the 5-chamber view of this patient, if I come to the 5-chamber view, again you can see this is the LV looking good, but when I go to the 2-chamber view, see, again after this is the LA, this is the LV, and suddenly the LV is showing such a huge aneurysm with a wide neck. This is the thinned out LV wall. So this is a very bad aneurysm that the patient has developed, and he is at a high risk of this LV aneurysm getting ruptured. So he needs some sort of like surgery very soon, and probably the relatives want some time to decide. You can clearly see the LV wall is thinned out, scarred, a bit shiny, which indicates infarct. This is the normal LV wall, but then too it is moving a bit less because it is infarcted. There is myocardial infarction. You can see this floating cloud. So this is a very good case of LV aneurysm, where the patient was saved because we gave him some sort of like anticoagulation and all the antiplatelets drugs. He is currently okay. We gave him diuretics to cope up the heart failure. He is currently okay, but then too he would require surgery for proper survival, and I hope he gets well soon. So this was for today a very good case of LV aneurysm. Henceforth, whenever you get such things on echocardiography, you should be very alert that we should do the necessary things and try to save such patients who are at such a high risk. So I hope this lecture would be useful for everyone. Let us meet in the next lecture very soon. Bye bye.